high-tech methods of solving the problem, but far more often the answer lies in simple treatments.
We decided to have a family basically when Friends started. We got used to the idea of having children around, and then Gary got himself a new job and prospects looked good, and we thought, well, why not? Now's as good a time as any. We waited about 6 months and nothing happened, so then I decided to go down and see the doctor.
Well, normally what we do when people come with this sort of problem is to ask them a few general questions about their health and about their lifestyle. Also what we'd be doing is doing a sort of general medical examination, and also there'd be some tests as well to be done. The sort of tests that I'd be thinking about are to check that you're ovulating, and from your husband's point of view, the sort of test that we would want to do for you is to do a sperm count. Okay.
Having a sperm test done must be every man's dreaded fear. I mean, everybody jokes about it, and I think we have a picture in our minds of being sent off to a little room somewhere in the hospital to produce our sample and bring it back in full view of everybody, and they're all sitting there thinking, we know what you've just done. This certainly isn't the case. Providing you get your sample to the hospital within an hour, you can quite freely do it at home.
We had to change a few things, try and give up smoking and drinking, and that lasted for about another 3 months. Nothing happened after that, and all in all it was about a year then, and then they decided to refer us to the hospital. The next stage, after they confirmed that I was ovulating and Gary's sperm count was fine, was to have my fallopian tubes investigated.
What we're going to arrange is an X-ray called a hysterosalpingogram.
Well, that sounds a bit complicated.
Well, I'll tell you what happens. You have an internal in the X-ray department, and they attach something to the neck of your womb through which they can put down to blow it through your tubes to show that your tubes are open. It can be a bit uncomfortable having that done.
Will I need to stay in for that? Or?
Oh, no, it's done as an outpatient. But I think what would be a good idea is if you get somebody to come with you, just in case you're feeling rotten afterwards.
Gary can come with me.
Right.
The whole procedure only takes about half an hour. That's from literally going into theatre to walking out again. And the only thing I can say about it is it's extremely painful for about 30 seconds, but well worth the pain. After I had my tubes blown, that was it. I didn't have a period, and I had a pregnancy test which confirmed I was pregnant, and the result is Charlotte.
When I look at Charlotte now, there's a mixture of emotions, a mixture of disbelief. It's just a feeling of, well, she's here. This is what we've waited for all this time, nearly 6 years, and can't wait for the next.
Mr. Tayob, how long should a couple wait before they seek advice on infertility?
Generally 12 months. And if a woman's older than 35 years of age, we see them at 6 months.
Right. Now, we tend to hear more about women's problems with infertility, but of course men are just as much of a contributory factor.
We emphasize now that it's a joint problem, and it takes two to produce a child. And we insist on seeing couples in our infertility clinics.
And of course, some men probably think that infertility is in some way linked to virility, that somehow they're not so much of a man.
The older groups and certain ethnic groups certainly find it very difficult to accept that the problem's theirs. Mm. A lot of younger men now accompany their wives to the infertility clinics.
And of course, the treatment for a man is quite straightforward, isn't it?
They're easier to investigate, and they're easier to treat as well.
Mm. So of the problems that face a woman with regards to infertility, what can be done about those? What are the most common?
The most common problem is lack of ovulation, and this can be corrected by a variety of fertility drugs. And the more difficult problem is tubal damage.
Blocked tubes.
Blocked
yes.
tubes, yes.
How does a woman's tube become blocked?
A number of reasons. The most common cause is infective, that she's had a pelvic infection from whatever source, and perhaps the biggest source is sexually transmitted diseases.
Right.
She can also have tubal problems from endometriosis or from a previous surgery in that part of her body.
How can a woman protect herself against such infection?
Limiting the number of sexual partners she has, and we've heard a lot about HIV infections. Certainly using barrier methods of contraception has reduced the incidence of pelvic infection. And perhaps when she suspects she has an infection, to present as early as possible for appropriate antibiotic treatment.
Yes, the quicker the better.
Yes.
Well, Mr. Tayob, thank you very much indeed.